Hello, everyone. My name is Michael McNutt, Director of Education and Events with WEDI, and welcome to our virtual spotlight, how adopting a zero trust identity strategy can help protect patient data. A little bit about WEDI before we begin the spotlight. WEDI is the preeminent national membership association for health IT guidance and collaboration. Recognized and trusted as a formal advisor to the Secretary of Health and Human Services, WEDI is the leading authority on the use of health IT to efficiently improve health information exchange, enhance care quality, and reduce cost. With a focus on advancing standards for electronic administrative transactions, promoting data privacy and security, WEDI has been instrumental in aligning the industry in an effort to harmonize administrative and clinical data. WEDI's mission is to provide multi-stakeholder leadership and guidance to the nation's healthcare systems on how to use and leverage the industry's collective technology, knowledge, expertise, and information resources to improve the administrative efficiency, quality, and cost-effectiveness of healthcare information. How do we do this? Through various ways, through our work groups and sub-work groups, which you'll learn about shortly, our task groups, our open public forums, our conferences, forums, and virtual spotlights like the one you're attending today, and our policy advisory groups or our member policy advisory groups. WEDI work groups provide ongoing industry guidance on numerous issues, including prior authorization, privacy and security, claim payment, and many other topical areas. We encourage you, if you have not already joined a WEDI work group, to do so by contacting Samantha Holvey, and you'll receive information about how to contact Samantha in the next slides. Speaking of work groups and privacy and security, it's my pleasure to introduce Marilyn Zigman-Luke with AHIP, who serves as WEDI's Privacy and Security Work Group Co-Chair and will be the moderator for today's event.
Michael, thank you for the nice introduction and good afternoon, everyone. I wanted to take a moment to give you a bit of information about the work that takes place in the Privacy and Security Work Group specifically, which I co-chair with Tina Grande from the Healthcare Leadership Council. The work group is comprised of a number of representatives who participate with WEDI, and they represent all different aspects of the healthcare industry, including providers, clearinghouses, payers, and many other types of entities. The work group really tries to provide an opportunity for collaboration and discussion on a number of what we call hot topics. So that can include pending federal regulations, it can include legislation as it's moving through Congress, different policy developments that take place, and a host of other topics that come up in our day-to-day business lives for all of those of us who work within the healthcare industry. What we try and do from WEDI's perspective is identify and work toward resolution of any implementation issues. And particularly with respect to the privacy and security of information, we want to make sure that health information continues to be protected despite which entity holds that data or through which that data is flowing, whether that's through an information exchange or some other platform. What we really try and do is provide a discussion forum to review privacy and security, which covers the HIPAA or the Health Insurance Portability and Accountability Act requirements, or the HITECH standards, and that's the Health Information Technology for Economic and Clinical Health Act. There are a number of other state and federal laws that can impact privacy and security of health data, as well as the exchange of that data and interoperability. And so the work group really provides a good opportunity to hear different perspectives and thoroughly talk about these issues as they're emerging. And then through WEDI, we work to provide information to the federal agencies who are working on these issues to really try and influence their thinking in terms of how best to go about implementation. Next slide. One of the key goals of the Privacy and Security Work Group is to stay abreast of security issues and certainly cybersecurity issues. And I'm really happy to introduce our presenter today, Zachary Martin, who is a Senior Policy Advisor from Venable. He is a trusted advisor for clients across the security ecosystem And for those of you who are participating, you know how important cybersecurity has become in the last years, if not months. He's going to give us his knowledge and perspective on what it means to have identity and access management, authentication, and how he really provides advice to clients with respect to cybersecurity, digital identity, and how those concepts relate to public policies. He's really worked in a number of public and private sector clients and clientele to help them navigate cybersecurity procedures and solve a lot of the challenges that they face. He is the author of Overcoming Zero Trust Obstacles in Healthcare, which was distributed by the Health Information Sharing and Analysis Center, what we commonly refer to as the Health-ISAC. So Zachary, thank you for being with us this afternoon and for sharing your perspectives. I know many—
Thanks, Marilyn. Happy to be here. Appreciate the invite.
Thank you. I know many are familiar with Zero Trust. Some may just be learning about it. So with that backdrop, let me turn it to you. Just a quick reminder to our participants, we have posted a link in the chat box to the paper. And if you have questions, as Zachary is providing his comments and his perspectives, please post those in the chat. We will take time at the end for questions and answers. So Zachary, let me turn it to you.
Great, thank you. Are you all seeing my correct screen? That's first of all.
Yes, I am.
Excellent. Well, again, thank you. I thank WEDI. Marilyn, thank you for taking the time today to hear me talk about zero trust in healthcare. As previously said, I'm Zach Martin. I'm a senior policy advisor at Venable LLP. I also want to apologize if I sound a little congested or coughing. I am recovering from my, sadly, second bout of COVID and still have a little bit of congestion. And I find that if I talk for any length of period of time, I sometimes have to clear my throat. So apologies for that. I have about 20 minutes of content to run through. And then, so we'll have plenty of time for questions at the end. I really do want this to be a back and forth. You know, I'll run through my content, but I really want to be able to answer any questions that you all might have at the end as well. So as Marilyn gave a bio, I've been in the cybersecurity industry for about 20 years in both public and private sector. Supported federal and state agencies on a variety of cybersecurity tasks, and now I work with a variety of different companies when it comes to cybersecurity and digital identity. I also spent some time in the healthcare industry as managing editor of Health Data Management magazine more than a decade ago, and I actually do remember attending a WEDI meeting in Rosemont way a long time ago. So I am familiar with who you are and what you all do. So yes, Venable is a law firm, though I am not a lawyer, but we have a small cybersecurity consultancy where we work with a variety of different clients to help them navigate different cybersecurity considerations. I also help run the Better Identity Coalition. It's an organization of identity providers and identity consumers who are focused on improving digital identity in the U.S. With Venable, one organization that we help advise is, as previously mentioned, the Health-ISAC, and that's the reason we are here today. Health-ISAC has a digital identity working group, and last year they were interested in finding out how zero trust would impact the healthcare market. I was the lead author on the white paper that I think Michael posted in the chat, so you all should take a look at that. That we ended up publishing on zero trust, looking at zero trust with a healthcare lens. You know, industries have their own peculiarities, their own things, but healthcare definitely has some challenges when it comes to zero trust that maybe not a lot of other industries would be dealing with. So basically today, I wanted to walk you through what we found in the paper and some other topics, including, defining zero trust, the problems that it solves and how it's different from a traditional security model. I'll show you all a digital identity framework that we created for Health-ISAC and how zero trust fits into that. I'll walk you through zero trust in action versus what a traditional security model looks like. We'll look at some of the core tenets of zero trust and what that means for healthcare organizations. What are some of the specific challenges healthcare organizations might have with zero trust, including specific considerations between payers and providers? And lastly, how to begin implementing a zero trust architecture. So, as I mentioned, I was managing editor of Health Data Management magazine, and early in my career, I spent time as a journalist working in a few different places. One of my first reporting jobs was at a place called the City News Bureau of Chicago. This was, at the time, a century-old institution where Ben Hecht, who had written the front page, worked, and that he wrote the front page, which was later turned into His Girl Friday. Kurt Vonnegut also worked at the City News Bureau of Chicago. And one of the famous sayings out of the City News Bureau was, if your mother says she loves you, check it out. Now, this might seem crude to some on the call, but the basic idea is do not take things at their face value. Make sure that you always have a backup, additional information on why something might be that way. This is the same basic concept behind zero trust. John Kindervig from Forrester Research was the one who coined the term zero trust, and his saying was, never trust, always verify. Zero trust architecture is a concept where the user on a network is constantly monitored and evaluated. This differs from a traditional security model where you log in once, you're assigned a role, and then you have access to the systems and data based on that role. The traditional model also uses the moat and tower model, where you don't trust anything outside the network or firewall, and you trust everything that happens within. Zero trust enables an organization to have greater knowledge and visibility into what people are doing on their network. Zero trust has become more popular in the last couple of years after President Biden signed an executive order mandating this architecture be used for all federal IT systems. And this has brought, honestly, that's why we decided to write the paper for Health-ISAC. And we have received a lot of questions, a lot of comments from our clients asking what they should do with zero trust now. An often asked question is, what problem does zero trust solve? You're going to likely get a different response depending on who you ask that question when it comes to cybersecurity. But as we enter the age of the remote worker and individuals accessing networks and systems aren't necessarily sitting in an office with security perimeter, additional checks are needed now. Usually somebody sits at a desk, logs into their computer, they're in a building, they badged in, and they use username and password, get in, they're good to go, able to access necessary resources. People are remote now. Pandemic means we have an increasingly remote workforce. There isn't that security perimeter. So now you need additional tools are needed. I'm going to focus a lot on the digital identity aspect of zero trust, but I will touch on some other aspects, the networking aspects of it as well. So, as mentioned earlier, with the traditional security model, an individual logs in the system, and based on that role to the credential, they have access to different applications and data. They may have used multi-factor authentication, a code or a push-based application to get into the network, but that's pretty much it. Log in, MFA, you get to do what you need to do. But with the amount of data breaches involving compromised credential, this might not be enough now. With zero trust, you must have multi-factor authentication to gain access. There's also contextual authentication with zero trust. These system looks at an individual's IP address, device information, software information, and other attributes associated with the transaction or the session. If someone is usually logging in from an IP address in Skokie, Illinois, and all of a sudden it's coming from Russia, that might be a sign that there's a problem somewhere. The device that the individual is using is also known to the system, so it's recognized as an additional factor. There's also monitoring that tracks an individual's movements through the network that makes sure they're not doing anything they shouldn't be doing. Other than multi-factor authentication, zero trust is invisible to the end user, unless there's something wrong and they don't have any idea that these additional factors are being checked. The bottom line, zero trust enables an organization to know who is on their network and what they're doing. In an age of a remote workforce, this has become more critical than ever before. Here we're looking at the Health-ISAC ID management framework with zero trust components have been added in red. The framework covers all identity use cases from employees, consumers, and third parties. On the right side, you'll see the systems and resources this covers. For those who are familiar with the digital identity and identity and access management, this is a pretty straightforward identity lifecycle. In healthcare, it's complicated as the number of devices on a network grows and the necessity of having all that information encrypted to make sure those devices haven't been corrupted and not doing anything they're not supposed to be doing. There's no reason an EKG monitor should be trying to access a billing system. Often when people think about digital identity, they just think about the username and password, and maybe the push-based apps and MFA. An often neglected aspect, and one that's extremely complicated, is in this framework is the idea of governance. The idea that the individual is also a valid user who is entitled to access the different resources. So governance entails creating, removing, and changing identities, granting and governing access, managing policies and procedures, managing privilege escalation requests and remediating misuse, and the auditing of identity systems. So it's all, everything basically besides the initial access request. What may be of particular interest to the WEDI audience is the focus on APIs in the bottom right-hand corner. APIs are now the standard way that information is transferred among different systems and networks. Something organizations will need in zero trust are security gateways. These are either on-prem or cloud-based. These gateways double check and make sure that the APIs are properly authenticated and authorized to do what they want to do. APIs can't do MFA. They can't hit a button on a phone to say that you are who you say you are, that you enable this transaction. And Security Gateway can help ensure that the APIs coming in and going out of an organization are properly secured. To do this, additional API development may need to be done when creating the APIs. Other changes to this framework include device inventory. You need to know what devices are going to be accessing your network. Core tenet of zero trust. Network monitoring, knowing what somebody is doing the entire time they're on the network. Encrypted communication, and dynamic policy-based authorization. So on this slide, we're looking, I know this is a little bit of an eye chart, and I apologize for that, but I felt that it was important enough to include in it. So these are the core tenets of zero trust based on this SP 800-207, their zero trust architecture. Excuse me. So the tenets are from this. The explanation is kind of my explanation of what that means, and then I look at the healthcare applications. This is definitely more focused on the caregiver setting, but there are still aspects of this for the payer community that I think are important. So briefly walk through what some of these core tenets are. So basically, number one, all data sources and computing services are considered resources. So again, everything that's on the network, laptop, personal device, corporate issue device, cloud service, all of that is tracked, is documented, is cataloged and inventoried. So in healthcare, the implications are you have a lot of different devices. You have, blood ox monitors, echocardiograms, infusion pumps. All of these are sent into a central monitoring station. So all of these devices need to be cataloged and inventoried to make sure that they can do what they're supposed to be doing, and also make sure they're not doing anything they shouldn't be doing. All communication is secured regardless of network location. So no matter inside or outside the perimeter, everything needs to be encrypted. I know a lot of organizations, will set up their intranet. Once you're, inside the network perimeter, that communication is not encrypted because it's within the perimeter, so we don't have to do that. That's not, that doesn't comply with the zero trust architecture. TLS 1.2 for everything, everything needs to be encrypted, including the information for the IoT device. Again, caregiver setting, this becomes a little bit more complicated. Access to individual resources is granted on a per session basis. So basically this means you need to log in and do MFA all the time. Again, on the payer side of things, if you're working in an office environment, this may not become a challenge, though MFA fatigue is real across all organizations, no matter what sector you're in. But it's important to do MFA and to re-authenticate and reauthorize per every session. Again, caregiver setting, somebody's moving, caregiver is moving from room to room, the glove, their masks, the usual MFA modalities like biometrics, and are not necessarily great. So you need to find a different way to do it here. Number 4, access to resources is determined on a dynamic policy and may include other behavioral and environmental attributes. Again, this is what I mentioned before about how the system, the device is looked at, the software on the device, IP address, geolocation, all of that is tracked to make sure that there's nothing anomalous that's happened before. So again, this prevents the heart rate monitor from accessing billing information or a patient's personal health information. Number 5, enterprise monitors and measures the integrity and security posture of all loans and associated assets. Again, constant monitoring to make sure there are no potential breaches or vulnerabilities. As I said before, usernames and passwords are not a great way to permit access, that they've been compromised, or there've been so many breaches. You need to make sure that nobody on your network is trying to elevate their privileges and get access to something that they shouldn't have. Number 6, all resources, authenticated and authorization are dynamic and strictly enforced before access is allowed. And this kind of goes along with the cybersecurity least privilege. You need to have, everybody has least privilege, not able to escalate their privileges based on just them wanting to see something. And number 7, enterprise collects as much information as possible about the current state of assets. And again, this goes back to constant monitoring of individuals' devices on the network to make sure that people are not doing anything that they shouldn't be doing. All right. So healthcare specific challenges with zero trust. I'm going to actually start with API security because I feel that that's probably the most interest to you all. Basically, you need to use secure APIs. I know that HHS has some guidance out there about that. You need to be using the security gateways to make sure that APIs are monitored and not doing anything that they shouldn't be doing. You need to treat APIs like devices. That you need to know what they're doing, not doing anything they shouldn't be doing, and that they are secure. Other challenges might be digital identity. I was trying to figure out what the use of MFA is like in the payer community and wasn't really able to find any statistics on that. So even if individuals are sitting in an office, they should be using multi-factor authentication. It's critical. Again, I know MFA fatigue is real, but username and password is not enough anymore. And MFA is a necessity, and even phishing resistant MFA is something that organizations should be looking at. And lastly is the IoT enabled devices. Again, this doesn't necessarily have as much implication for the payer community, but that's going to be probably a challenge in the caregiver setting. You need to make sure these devices can be authenticated and authorized online, that their communication from these devices can be encrypted, and that there's also least privilege, that these devices can't be corrupted and do things that they shouldn't be allowed to do. So here we go, steps to begin implementing zero trust. So the first thing you need to do, look at what you have, look at your current state. What authentication and authorization policies are in place? Talk to your network security team, find out what monitoring is being done currently. Is all communication being monitored? Can your network be micro-segmented? How does your organization handle APIs? Is it the application development team that's creating the APIs? Is it something else? What standards are being used? Are you using secure API coding standards? Do you have a security gateway in place? What will it take to get one? And also talk to your current vendors. Zero trust is a buzzword. I'm not gonna cybersecurity has falls into rut of falling in buzzwords. But talk to your current vendors. They know zero trust is important. It's coming. They are changing their products. They are adapting their systems so that they can meet zero trust requirements. You might have systems that have zero trust components already involved, which is a matter of, making some tweaks to policies or procedures and to, implementing it. So it's just basically got to look at what you have, talk to your vendors, figure out what you need to do. Maybe you need to swap out wholesale systems. Maybe you don't. Maybe you can just make some changes. But until you know what you have, then you can't move forward. Also, it's not going to be something you do overnight. You're not going to snap your fingers and all of a sudden have a zero trust architecture. You need to take a phase-in approach. I hate the term. I go back to my consulting days. And look at the low-hanging fruit. What's the easiest quick wins for you to get zero trust? You might have some aspects of it, and tackle those first. Your network might be in great shape to start the monitoring. Then look at your digital identity system. Maybe there's an upgrade that you can make there and comply with zero trust. So evaluate your current systems, talk to your vendors, figure out how to do it, but take a phased-in approach. You don't want to break everything that you currently have, and basically it takes some time. This isn't going to be something you do in 6 to 9 months. This is a journey. This is a 1 to 3 year process typically, is from what I've seen. So with that, I will pause and take some questions.
Well, thank you for that, Zach. We do have one question in the chat from Stanley. Stanley, thank you for joining us today. What is the cost and additional system overhead of zero trust compared to, say, what we would call the traditional security approach, the traditional way you do architecture?
Well, sadly, Stanley, I have to give the usual, the famous consulting answer of it depends. I know that's not necessarily what you probably want to hear, but every organization, every enterprise, every network has their own peculiarities, their own things. So it's difficult to say, what the cost would be associated with that without knowing what systems you have in place and what needs to be replaced and the time associated with it. It's hard. It's almost impossible to say not without knowing what you have in place. And I would be hesitant to throw a dollar figure out there one way or the other.
Zach, can you share with us what some of the goals would be for companies who are looking to move to zero architecture? In other words, what goals does it help them achieve based on, compared to that, based on what they might have today?
Sure. Well, basically greater visibility into who's doing what on their network, like especially, post-pandemic world, remote workforce, you don't have people sitting in an office. So you need to have insight into remote workers and what they're doing. You need to make sure that, their credentials haven't been compromised and that, somebody isn't using their information to access information that they shouldn't. So basically it gives you a little bit more flexibility, but also greater insight into who's doing what on your network, without having anything from the. So if I'm the employee and you're an organization that implements zero trust, unless you've made significant changes to your identity and access management system, it's going to be invisible to most employees and most users. They're not going to have any idea that you've made the change. So it's just a matter for an organization. It's a matter of knowing who's doing what on your network and making sure that nothing bad's happening.
And this may be a technical question, I'm not sure, but
I can try.
How can a company leverage their existing security and networking infrastructure as part of a transition to zero trust architecture? Or is it really that once you want to go to zero trust, it's a total overhaul? And
It's not necessarily a total overhaul. Basically, again, you really need to do a current state assessment of your network, your identity management, your monitoring tools. In all likelihood, you have portions of zero trust already around. It's just a matter of, all right, this is what we have. We do network monitoring when individuals first log in, but then we don't know when they're accessing different applications. So we need to add that, we need to add that to our monitoring system. It's just a matter of assessing what you have and then figuring out what their capability, what the current capabilities are. Can those be expanded to zero trust, and then making that happen.
And a couple of the questions that we have, and Rob is with us from WEDI. Thank you for joining us, Rob. One of the things in terms of security vulnerability, everybody knows is you could put all the right things in place, but there is always human error. So
yep.
two questions out of this. One is really, what strategies would you recommend for changing the culture within an organization? And then also a follow-up with that, what sort of training would employees need to get accustomed to zero architecture? Or maybe are they not, needing to know that much about it, and it just sort of operates behind the scenes? Can you talk a little bit about that?
Sure. I'll take the second question first because that's easier. So in all honesty, unless you're, again, as I mentioned before, as long as you're not swapping out your identity and access management system, there will be no training, no change to the individual using the system on a daily basis. It should be invisible, unless there's the instance where, my company, they know I typically am working from home and my house is in the Chicago suburbs. My IP address doesn't change, but then all of a sudden it's like, oh, I'm in Mexico on vacation, and I decide to log into the VPN to check my email or to respond to something, approve an expense report, whatever. And they're all of a sudden, hey, why is Zach all of a sudden logging in from Mexico when he's usually logging in from the Chicago suburbs? So that might trigger a re-authentication event or an out-of-band authentication. So it'd be like, hey, we just want to make sure you are who you say you are. We sent a code to your personal email address. Can you please, a window will pop up saying, please enter that code into, the window now, or, please re-authenticate in some other manner because your behavior is different from what we're used to seeing. Other than that, it should be invisible to the end user. Again, unless you completely change your identity and access management system, introduce new multi-factor authentication, there's no real training on for the people who are using the system every day. Now, the more complex question: how do you get leadership buy-in? And that is a challenge at times. Really, the way you kind of have to pitch this is to look at it, it's like, look at the amount of data breaches out there. Look at how they're getting in. Still, I think last year's Verizon data breach investigation report still had it around 2/3 of breaches are caused by compromised credentials, so 66%, which is, I think, down a little bit, but still 2/3 are caused by compromised credentials. So by enabling multi-factor authentication, even bad MFA, because now MFA is created equal these days, you could probably cut down on that. And then you could tout it by, the information that we would have from implementing zero trust wouldn't let us know what our employees are doing, what they're accessing, so we would be able to spot a data breach or something anomalous quicker than we would at this point. It's still a tough sell. You're talking likely, an enterprise of any significant size, it's going to cost significant resources. It's going to take time. It's going to take people to implement the changes. So it's, you sell it as a way to prevent data breaches. and potentially maybe improve the user experience. Like, again, I talked about MFA fatigue before. I was at the Health-ISAC conference back in December, where that became a very hot topic. And as much as I knew it was a thing, I didn't recognize it wasn't the realization that it was as big of a thing as a lot of people are dealing with on a daily basis. But if you can make MFA easier, but still keep a high security posture, it's a good way to be too.
Zach,
I don't have a great answer. Sorry.
Yeah, I think that's a good answer. And just sort of a follow-up to that, one of the things that's happened in healthcare is what we describe as the Trojan horse. Something gets into the system, and it's been problematic in past years because historically some companies didn't even know that they had either somebody siphoning off data or changing data, or simply just, in the system monitoring the data. And then by the time that they found it, they had to report that there was a data breach, et cetera, et cetera. But then we're, surprised to find out that this had been in the system, perhaps even for years. Does zero trust help in those situations?
Very much. That's the monitoring aspect of things. Would theoretically, I'm not going to say 100% certainty with 100% certainty, but would theoretically be able to spot that. It's like all of a sudden it's like, oh, why is this user, or why is this login all of a sudden exfiltrating all of this data out of our network? What's going on here? And zero trust, because of the monitoring aspect of things, would be able to spot that and shut it down.
And one of the questions from Charles in the chat is, how do you think we can contribute to the security standards to improve zero trust or security within healthcare? Are there any particular standards organizations that you would recommend?
Not at this point. Zero trust, as much as it's been around for a decade, I don't know if there's anything that's necessarily standardized around it. Because you have digital identity, you have network monitoring, you have API development. There's lots of different pieces. I would say follow what NIST is doing. NIST had released the SP 800-207, the zero trust architecture. That is not necessarily very technical documentation on exactly what you do. It's more of a policy aspect document. But I would look at that. I am a bit of a standards geek, and I like NIST. I used to support NIST in my consulting days. So I think they do good work. They just recently released their latest draft of 863-4 digital identity guidelines that looks at phishing resistant authentication, which is something that folks should be looking at as well, so that your MFA can't be phished, because some can. So I would pay attention to NIST. OMB's got some, White House Office of Management and Budget has some documentation out there when it comes to zero trust. But as far as I know, and I definitely haven't done research onto this, I don't think ISO or ANSI, any of the big standards groups are doing zero trust standards at this point. But if there's somebody else out there that knows differently, please chime in the chat.
I don't want to put you on the spot, Zach, if you're not familiar with TEFCA, but TEFCA is the Trusted Exchange Framework and Common Agreement, which is intended to really make health information more interoperable and really empower consumers so that their records are more available at the point of care, et cetera. The question is, what do you think of TEFCA security, and how will that drive security in health information exchanges?
Well, TEFCA actually points to 863-3, which is the previous version of the digital identity guidelines that were released in 2017. And they have, try to go over this quickly and in a non-geeky way as possible. So 63-3 has an identity proofing standards, and TEFCA calls for the use of IAL2, Identity Assurance Level 2, which is a good, so basically it requires, requires an individual to be identity proofed, basically have their driver's license, you could do it remote. So basically somebody can use their smartphone or a laptop, take a photo of the driver's license, then there's a selfie match with the person presenting the document, having their photo matched to the one that's on the document. And then all of the demographic information that's on the document and all security features are also checked. And that theoretically creates an IAL2 digital identity that can then be used to do healthcare transactions. That's what TEFCA is aiming to do. It's a good thing. IAL2 can be tough to meet for a lot of organizations. The technology that enables it, the document match authentication can be tricky. Especially for those with dark skin. Face recognition is not always great. It's been a problem. So it's just, it's a good standard, but there's still some technology challenges behind it. The latest draft is the 63-4 still relies on that. They are trying to figure out a way to do IAL2 authentication or IAL2 identity proofing without the document match authentication, but it's definitely a challenge. So it's something that I've been watching a lot. And actually the next Health-ISAC white paper that we're putting out is dealing with identity proofing. So we're going to be talking about IALs quite a bit. So so that's that should hopefully will be coming out in the next month, 6 weeks.
We'll certainly keep watch for that. In terms of your experience, are there any barriers to the implementation of zero trust? And has there been any pushback from the vendor community or employee groups?
None that I've seen. Again, since it's more or less an invisible thing to the employees, there's not any challenges there. I know the tracking and the monitoring of the individual sessions and what they're doing might be, some people might look at that as being problematic, but I don't, again, I'm not a lawyer. So I'm gonna, even though I work for a law firm, I am not a lawyer. I'm not sure where the legal precedent stands on, if you're looking for things on your web browser that you shouldn't be looking at during the work hours, where that stands. So, but I haven't heard of anything at this point. As far as the vendors are excited to get to sell more stuff. That's kind of how I look at it. I have not heard any pushback from them as well. So.
And one of the questions or one of the things that you talked about had to do with auditing. Do you recommend that be done internally, externally? Does it not matter?
I think organizations need to have people looking at stuff on a daily basis for internal, like to see if there's anything anomalous happening on their system. So it's a matter of, you have a security operations center, you need to be checking things on, regularly to make sure that nothing's happening. Now, do third-party audits help? I think if you have an incident, if there is a breach, bring in a third party to potentially review what happened and where there might have been a lapse isn't necessarily a bad thing. And depending on the regulatory environment, it might be something that one has to do.
Ruby is with us today, and she's one of our most active members of the Privacy and Security Workgroup. So glad that, Ruby, you could join us. She's asking if there is one area that you think everyone should focus on as a first step. In other words, is there one area where everyone's weak?
Again, it's going to depend on the organization and what systems you have in place. And my bias will show here. I think digital identity is kind of one of the first places. I think multi-factor authentication, turning on multi-factor authentication, while you might get, if you haven't used MFA and you're turning on MFA for your employees for the first time, you might get some pushback. They're like, why do I have to do this? Why do I have to use my own download an app to my own personal device or get a text message to my own personal device in order to access the systems I need to work? This is unreasonable. I've seen that. I definitely I've know that that's been a thing. So, but MFA is just, again, even SMS OTP, which is not the best, again, MFA is not created equal. It's gonna help your organization. It's going to prevent some of those easy data breaches from happening. And it's a relatively simple thing to turn on to help secure an organization.
Okay, and Janice is asking in the chat about any special concerns or requirements that you see for zero trust when using APIs and what she refers to as the OAuth 2.0, which for those who are participating with us, Janice is describing it as the way that you authenticate the requester when using the REST APIs.
Yeah, I'm familiar with OAuth and the authorization spec. This is a little bit more technical, Janice, than I'm used to being able to answer. So I'm looking at your question right now to see if I can parse it and at least answer some part of it. Yeah, I have to apologize. I'm not really that familiar. Like, I know what OAuth is, I know what the spec is all about, but I can't say if there is any special concerns or requirements when using OAuth for APIs. I have to apologize that that's not something I'm ready to, I can answer in an educated way.
That's okay. Janice says no worries. One of the other questions that we had, you talked about using geolocation and having that integrate into the zero trust. Are there any individual privacy concerns with that?
There can be, for sure. It's honestly, it would probably be one of the ones that I would be least excited to, even though your IP address is somewhat geolocation, I would rely on, there are a variety of other attributes that can be used other than geolocation in order to enable zero trust. Again, device information, the software information, and that's stuff that's all owned by the company. So checking that, there's no privacy concern. Maybe not no, but there's minimal privacy concerns. Whereas geolocation is definitely raises that flag. So organizations are also able to choose which attributes they want to check. So geolocation can be one, but it can also not be one, depending on the privacy posture of the employees and the company.
And two more questions, Zach, and just as a reminder to participants, if you have a question in the time remaining, please feel free to stick it in the chat, and we'll ask Zach while we have him here for his expertise. We're doing zero trust now. We've been hearing a lot about quantum computing and how it could make technology that we are moving toward today become outdated very quickly. Do you have a perspective on quantum computing as it applies to zero trust?
Well, it's definitely, quantum computing becomes complex when you talk about the encryption, the algorithms we currently use for encryption, and the fact that quantum computing would be able to crack those encryption algorithms fairly quickly compared to now. NIST, again, going to name drop, NIST has a list of recommended algorithms that they recommend people using that would not be susceptible to quantum computing. So I don't know those off the top of my head, but I know that they published them within the last 6 to 9 months. So I would look at that. Like, is it a concern? Yes. But like, how quickly is the concern? Like, it's not like we're not going to be having quantum computing breaking encryption tomorrow. This is definitely a problem for somewhere down the road, but it's going to be a problem that everyone has to challenge because the entire internet runs on TLS 1.2. And once that is cracked, then we're going to have to move on to something else.
And you talked a bit about APIs and treating them like devices, and that the APIs really need to be considered in terms of also the security gateways. Without getting too technical, as we move into TEFCA and some of these other environments, there's going to be a lot of different connection points, we'll call them. How does zero trust within one organization help when you're part of that larger ecosystem where you might have a connection point and then somebody you're connecting with has other connection points, and you're doing what you can, but you can't ensure that everyone else in the ecosystem is doing the exact same.
Well, in a perfect world, especially, I know healthcare has some standards when it comes to APIs that are emerging. FHIR, I believe, and please, hopefully I'm not talking over my head on this one, but I know that there have been some proposed standards. And back in my implementation days, I remember that, even if you were building an API to connect with another system, you had to test that API and make sure that it was secure and that it was doing everything that it was supposed to be doing. That's the way it's going to be. So it's hopefully we're going to see more of a preponderance of these gateways to make sure that the API that's requesting information from Northwestern Memorial Hospital is authorized to send that to Blue Cross Blue Shield of Illinois. And there's just the API gateway looks at it, makes sure that it's secure, that it's authorized to do everything that it's supposed to be doing, that it was pre-registered and doing it on a regular basis. That's where we're going. I would say that that's probably one of the areas where we have kind of the most work to do. I was working a couple of years ago for a federal agency that was implementing their first web gateway. And it was complicated. Like you're thinking, oh, APIs are pretty much commoditized. It's not that big of a deal. No, not when you're trying to really make sure that they're secure, that they are, doing what they're supposed to be doing and not doing anything they're not supposed to be doing. It gets definitely much more complex.
And this will probably be the last question unless we see any more in the chat, but we've got several folks, Stanley and Ruby, are both asking about VPNs, the virtual private networks. And is there a role for VPNs in zero trust? In other words, can they be trusted?
As long as they're from a reputable source. I had a family member recently asked me, she was thinking about getting a VPN for home use on an everyday basis. And my main question was, I'm like, well, what exactly do you need it for? Why are you going to be using it? And not all VPNs are created equal. You get some VPNs that are for consumer use that you can just use to, that they're basically taking your information, selling it to marketers so that they can sell more things to you. On the commercial enterprise side of things, it's not the same. Like if you're using a Cisco VPN, that's safe, that's secure. There's still space for VPNs when in a zero trust environment, but I think even the dream is to get away from that secure tunnel and kind of have a borderless system. And as someone who's been in cybersecurity, and it's still I have trouble wrapping my head around this. I'm like, is this really going to work? Zero trust, I think it's a great idea. It's a great concept, but I still am used to that moat and tower, mentality where it's like, all right, you authenticate, you MFA, you're in the network, you can do what you need to do. You're outside the network, you can't do what you need to do. It can be a challenging concept to wrap your head around, but it's where we're going. It's going to offer more flexibility. It's going to offer organizations greater insight into what's happening on their network. And as we, see a more remote workforce across the country, I think that's just general direction that we're going.
We've had one request for after the event. If you could please send to Michael or myself the number of the security standards of 2017 that you mentioned. We have some interest there.
That's NIST 863-3. So that was mentioned in the last question I'm just seeing right now too. So NIST 863-3 is that security standard.
And that is available on the NIST website.
Yep, just Google it, you'll be able to find it. And then again, the draft of 63-4 was released in December.
And can you say more about where NIST 800-63 is inadequate for identity and zero trust, and whether references to it, for example, TEFCA, as we've talked about, should be reevaluated?
I don't think it's inadequate in any way. I think the technology that enables it can be, not perfect. And I was supporting NIST in 2017 when it was released. And at that time, there was nothing like what had been proposed for the identity assurance levels. The idea of taking a photo of your driver's license, using facial recognition to match the photo with the person presenting it, and then having all that information checked on the back end with a third-party database. This was only 6 years ago. That didn't exist. Now, I'm not saying it's common, but it's much more common now than it ever was previously. It's still new technology. And as we work out the bugs on new technology, make sure that the facial recognition systems are equitable for everybody, that's what needs to be done. We need to make sure that this system, especially for TEFCA, especially for making sure that anybody can be identity proofed in order remotely to access the systems or to access benefits, it's critical. And it's a bigger problem in digital identity that needs to be tackled. Conversation for another day, but it's not inadequate. I think it's fine. It's just a matter of finding the right technology that fits your organization's need. As for Zero Trust and 63, doesn't really, 863, even the -4 that just was released, doesn't get into Zero Trust specifically. I know NIST is working, other folks at NIST are working on different things for Zero Trust, but I would not say that 63 doesn't touch on Zero Trust. The biggest thing in the draft of 63.4 is the idea of phishing resistant authenticators, which has also been mentioned in some of the OMB memorandums that have come out for federal agencies.
Well, Zach, there are no more questions in the chat, and we are coming to the end of our time together, but I want to thank you very much for all of the information you've provided and really for the very robust questions. I feel like we've been sort of in a lightning round here, so appreciate you answering all of that.
I hope it made sense. I hope it was understandable to you all. If any questions, please, you got my email address. Let me know. I'll do my best to answer. I appreciate you all having me today.
So, Michael, I think it's time to turn back to you.
Well, let me stop sharing. Sorry.
Yes, it is. Thank you so much, Marilyn. And this concludes our special WEDI virtual spotlight on Zero Trust authentication. A special thanks to Zach Martin for being a fantastic presenter, and special thanks to Marilyn Luke for being a fantastic moderator.
Thank you.
And with that, I'd like to bid you all adieu. Have a fantastic week, and be sure to visit wedi.org for more information on upcoming educational events. Thank you. Have a great day.